For over 50 years, VA Palo Alto healthcare system has prided itself on providing exceptional care to the brave men and women who have served in our country's armed forces. 1917, the United States has just entered World War I. Menlo Park, California, a small town of only 2,300 residents, will soon be transformed into one of the largest military training grounds west of the Mississippi. Named in honor of Major General John C. Fremont, Camp Fremont trains more than 43,000 soldiers and constructs over 1,000 temporary buildings during its 2-year lifespan. In 1919, the Menlo Park Hospital is transferred to the jurisdiction of the U.S. Public Health Service and becomes a specialized tuberculosis treatment facility. In 1921, the federal government establishes the U.S. Veterans Bureau, the first agency to consolidate all veteran benefits under one roof. Under management of the Veterans Bureau, fog-shrouded Menlo Park is deemed unsuitable for TB patients. A new campus is opened in April of 1925 in warmer, drier Livermore. Menlo Park is repurposed as a neuropsychiatric inpatient hospital. In 1945, Congress authorizes the construction of nearly 60 new VA hospitals. The Palo Alto Veterans Hospital opens in 1960 at the southern edge of Stanford University. This proximity results in a strategic alliance between the VA hospital and the Stanford School of Medicine. October 17, 1989, 5:04 p.m. Catastrophe strikes the Bay Area.
I came to the VA Palo Alto in 1985 and retired 22 years later. My role here was as the campus architect, and the major project that I worked on was the replacement hospital after the Loma Prieta earthquake. It was an amazing effort by the staff. After the earthquake, we had to move 150 patients out of the hospital building. We pulled blankets and sheets to lift the patients out. We put patients in wheelchairs to carry them down the stairs. The elevators were not working. And this was all done inside of 30 minutes. This was a moment that forever changed the VA Palo Alto healthcare system.
The patients were living in trailers, boxcars and so. I remember all that too. And when they moved from the boxcar to this, well, it's just heaven to them, It's such a difference.
In 1995, Livermore, Menlo Park, and Palo Alto integrate. Over the next 15 years, Palo Alto opened 7 new community-based outpatient clinics. The number of veterans treated more than doubles.
Our mission is really just about patient care. I think that's one thing that sets VA care apart from healthcare elsewhere in the United States. There really isn't so much of a business aspect. What we're concerned about is what care does the patient need and how do we best deliver it.
Today, VA Palo Alto healthcare system manages one of the largest graduate medical education programs and one of the top 3 funded research programs in VA. By the mid-2000s, VA Palo Alto healthcare system is ranked one of the top VAs in the nation. Its reputation for patient and employee satisfaction is backed up by outstanding survey scores.
The way this place is organized and the way things are done and the use of the computer at a high level of performance, and to transfer your medicine, your tests that were done in the lab at noon. By 4 o'clock that day, they're already into your file.
The services I've had here have been first class. I mean, the electronic record system is just outstanding, and you can always get an appointment. I would say this is a flagship of the VA hospital, as far as, in my opinion.
Over its 50-year history, VA Palo Alto has really grown. It offers not only comprehensive primary care, but a full array of specialty services.
Along with emphasis on caring for our sick and injured veterans, comes a new push to reach out to homeless veterans.
When I got out, I was still using drugs. I started getting real heavy with the gangs. My life was just in shambles. The Homeless Veterans Rehabilitation Program taught you to change your behavior, change your thinking, to look at the whole picture.
I was homeless for a bit. and was just battling with, having PTSD, just being present, even coming to work. And I do agree that to be better, you do have to get the help that you need. And that's just real. I'm just living proof.
Today I can walk down the street. I can be proud of myself. I can hold my head up high, and I get up in the morning, look in the mirror, and like what I see today.
I think one of the advantages that VA has over its civilian counterparts is that we really understand the mission of veterans and servicemen and women. With being a serviceman or a servicewoman, there are circumstances that are unique to that population that are not seen in the civilian population.
The men and women coming back from Iraq, mental health issues are going to be big. That's a key for the VA to be tackling right now, and they're going to continue tackling this, because if you look back at Vietnam, here it is 30 plus years later, we're still dealing with those issues. So we're just on the cusp of even dealing with that. So this is going to be some long, serious research, and just being with the vets and letting them know that the VA is there for them and they will help them.
As far as medical care is concerned, and psychological care also, because being around veterans, that has a lot to do with getting well.
The treatment for women at this VA has improved tremendously in the years. As we live, it seems like they're getting better. I'm glad that they are taking care. As a matter of fact, some of the women outside say, VA taking women, that's for the veterans. So I said, the women are veterans too.
In 2006, Fisher House opens to provide on-site temporary housing for families of veterans who are being cared for at VA Palo Alto. To care for our most severely injured men and women wounded in Afghanistan and Iraq, VA Palo Alto is designated as one of only 4 polytrauma rehabilitation centers in VA.
The current conflicts in Iraq and Afghanistan have resulted in injuries of such severity that in prior conflicts, our veterans certainly wouldn't have survived.
My name is Jason Poole. I was in the Marine Corps, and I served through 2000 to 2006. I was on patrol, and a massive IED explosion blew up, and I was in a coma for 2 months, But this is I don't remember anything else. When I arrived, I couldn't speak, I couldn't talk. I had scars all over my body, and I had shrapnel all over my back, and in my left ear, I'm deaf. In my left eye, I'm blind.
Throughout VA Palo Alto healthcare system's history, volunteers have stepped up to assist staff in providing the care our veterans deserve.
I'd say the biggest thing I get out of volunteering today is a free lunch. Oh. No, not really. It's a satisfaction of seeing other veterans being helped.
It helps me a great deal. It helps me understand the patient. It helps me understand what's been going on, and it leaves me feeling that I'm doing something. And at the end of the day, I feel very grateful having spent the day at the VA, because I've gained a lot, and I hope that I've made those that I talked to feel better also.
I don't care what branch of the service you came from, there is a camaraderie with a veteran. A veteran is gonna help a veteran. I see it every day. And it's a brotherhood. It's a good feeling. It really is.
And be able to step away and go, okay, what can we do to help? And I think that goes right back into the changes that have been going on in the VA since I started in '86, is that everybody wanting to help.
VA Palo Alto wouldn't be the extraordinary medical facility it is without the men and women who work tirelessly 24 hours a day, 365 days a year.
As we look forward to our future, we're going to see new buildings, new investments in technology that are going to allow us to diagnose patients with greater accuracy and more quickly. We're going to see innovations such as teleradiology, where we can view images from around the country. We're going to be providing care in a patient's home using telemedicine. But when it comes down to it, what will lead us into the future will be the same things that led us through our past, and that's the people who care for our nation's veterans. President Lincoln said that it was our duty to care for him who was born in the battle. That pretty much sums up the mission of the VA. It's very simple and it's very direct. We care about the clinical care and the needs of our patients. That's it.
Deep within me, there's an appreciation for the people who take care of us every day.
I am thankful. I'm blessed, but I'm thankful.
Thank you from the bottom of my heart.
I just want to say thank you. You have been a real blessing to me.
I want to thank those who have served, and I want to also thank the VA.
You can't embellish a simple thing like thank you. Thank you.
I'm very, very grateful, very grateful. They saved my life.
So the doctors and nurses are sent from God because they saved my life.